I'm doing biology and that for O-level. Don't like it, but Mum says I need it for being a doctor. Don't want to be a doctor. I want to be a soldier.
Bloods, drugs charts, first dose IVs, Venflon. Mr. Edwards has spiked a temperature again.
Who bloody Ray? £2 an hour I get for this. Compared to me, the geezer who's teasing body bits out the drain under the morgue is pampered. I can think of no more miserable way to spend a Saturday afternoon than to be second on house officer for crap like this. Stuck in this festering cackhole of a hospital with not one single thing to endear it but the breathe in, peekaboo, and out. I can't find anything which might explain your temperature, but I think we should do some more tests of your blood and urine just to be on the safe side. I'd never forgive myself if I overlooked a simple problem we could treat. Can't I be doing yourself a mischief, Arthur?
But my name's not Arthur.
This one's for me. Something to stop vomiting.
I have an urgent bleep message. Babe alert. Lecter ward. Babe alert. Lecter ward.
Claire's still up to her neck in that DKA, so maybe you could see this next one we've had in. 59-year-old man, recently widowed, dithiopin overdose during the night. Will you be washing him out?
Not if the OD was last night.
Well, Claire might insist on washing him out anyway. Make him think twice before taking another one.
The last thing this man needs is to be punished for what he's done.
Excuse me?
I thought you'd be busy down here, so I picked you some sandwiches up before the canteen shut.
Thanks very much.
Would you lavage someone who OD'd last night?
No, but you can't always rely on an uncorroborated history from someone who's just tried to top himself.
Well, you can make any excuse if you resent ODs enough.
Even contempt counts as emotional involvement. Not my style.
Dr. Maitland, can I ask you not to eat in the department, please?
Unlike you, Charge Nurse Sutton, I don't get protected breaks and meal times. In an environment in which I can work a couple of days without even a sit-down, I'll eat where and when I please. Oh yeah, that LVF we were expecting died in the ambulance, so that's one less admission to Clark.
So what about this overdose then?
No washout.
Present the case, Dr. Roger.
Clinical inspection revealed little apart from her chronic pulchritude. I then called upon the most searching instrument of investigation known to medical science. I asked ward sister to check her out.
Excellent.
She is Miss Judith Edwards, age 23, legal secretary, self-referral to the ward, visiting her father, Mr. Ronald Edwards.
Well, whatever her dad's got, he's bound to get better. Nothing guarantees round-the-clock medical attention like having a gorgeous daughter.
Ah.
Premiership. Arsenal 0, Manchester City 0. Chelsea 1, Norwich City 2. Country City 1.
Oh, United went down again.
I don't really follow football, Mr. Blewett.
No, I don't suppose you would.
Cardiac arrest. Caroline. Mr. Blewett, cardiac arrest.
Can you...
What the bloody hell are you gawping at?
Mr. Blewett has these funny turns sometimes.
Petit mal epilepsy.
Well, come on, sunshine. Patience to see, lives to save.
Bye for now.
It's the first we've seen of them two all day. No doubt they've been in the doctor's mess drinking rivers of tea.
At least that false alarm brought a bit of glamour to the ward.
I really don't know what men see in Claire Maitland.
No, Andrew.
He's He's not exactly a pump-action six-gun lover.
Do tell.
He's normally too tired to be decent company. If he worked all the time he claims to, he'd be doing 100 hours a week.
He does, doesn't he?
Hello there, this is Staff Nurse McDougall on Lecter Ward. The RSO's accepted a patient of ours for transfer to you, a Mr. Hector Gonzalez, aged 107. He's alcoholic, senile, incontinent in both urine and feces, and his bed sores are infested with maggots. If you do manage to catch any of his diarrhea, it needs sending off for culture. I've written up Mr. Martin's treatment for his Peyronie's disease. Sister Jackie took the call from the GP. Trevor, I've told Nurse Whitecoat that the old sewer, Mr. Martin, has Peyronie's disease. And at this very moment, she's applying ointment to the affected part of his anatomy. Doesn't that affect your... Willie, yes.
The medical officer's given steroids, but the patient's still very wheezy.
Right. No chance of you being on steroids after your slug-like approach to that crash call?
The only thing to which an on-call doctor should respond instantly is the opportunity to sleep.
The caring doctor learns as much from listening to their patients' troubles as from listening to their heart.
Didn't Dr. Hilary Jones say that last week?
My mum says I look like him.
I think he's disgusting.
Girl's name too. Were there these little marks on your fingernails yesterday?
Not sure.
I completely forgot to ask you. How'd you do in your exam?
I failed. Let's hear about Mr. Edwards.
He has a prosthetic heart valve and he's had low-grade pyrexia and malaise on and off for a week. Now he has splinter hemorrhages and I think his murmur is louder.
2 blood cultures this week have shown no growth. If you're worried, repeat them.
Don't you think there's still a fair chance he's got endocarditis?
Dying for a shower. Could you take the RSO bleep for half an hour, please?
Hello, Dr. Raja. Oh. Hello, Mum.
Are you busy?
I am, actually.
You're eating properly, I hope.
Of course I'm eating properly. I know hospital food isn't...
Bring you something in at lunchtime.
No, don't bring me anything in at lunchtime.
Am I embarrassing?
Of course you don't embarrass me.
When are you coming home?
Next weekend?
Oh, I look forward to it.
Okay.
You can meet Mira.
No, I don't want to meet her. Because her dad's a gangster, that's why.
I know you're busy, and I know you don't like me coming into your work, but I'm afraid I care about you. I can't just stand back and watch you falling apart.
Peter, I failed. For the past 4 months, I've spent every spare minute studying. Working 90 hours a week, running a home and raising 2 children. I just can't face having to pick up the pieces again.
Monica, I can understand.
No. You can't even understand the tiniest part of what it's like.
Cut. Cut.
was wrong with you this morning.
Sorry, Mr. Bettencourt.
Cut. I think we're finally in business with this graft.
Sorry, Mr. Bettencourt.
Raj swap places with Monica. It's time the little lady stood in the back and left the brain work to the men. What a fine demonstration of your gender-specific aptitude for surgery, Raj. You've just wiped out the graft we've been working on for 2 hours.
This gentleman took an overdose of dithiapine on Friday night and was brought into casualty Saturday afternoon. He's given activated charcoal. There's no complications.
I should think you could come off the monitor now. Psychiatrists to see, please. Oh, so far they've been unable to find a locum to cover Dr. Mardhu's leave. I'm sorry, but I've been asked if you'd be prepared to do tonight.
We've just worked an unbroken 50 hours, Dr. Turner. Surely Andrew can't be expected to go another 24 without sleep.
I fully agree, but this situation has rather been thrust upon us.
Dr. Turner, with respect, I honestly feel I couldn't take another night.
In that case, I shall do everything in my power to ensure that alternative cover is found.
Thank you very much, Dr. Turner.
That's what I'm here for. But if there isn't any alternative, you're not going to let us down, are you, Andrew?
This is the second fluid balance chart, which hasn't been completed, sister.
I'll make it known to the warden, Mr. Bettencourt.
Mr. Bettencourt, I wondered if you'd mind quickly seeing Mr. Edwards this morning.
Post-take rounds either take patience.
Raj thinks he has subacute bacterial endocarditis.
Make it quick. There are some splinters, yes. But there's plenty of evidence of trauma. What's your job, sir?
A cabinet maker.
Dr. Broom?
3 sets of cultures, all negative.
Well, I'm sure there's nothing to worry about. He's not ill enough for SBE. Monitor temperatures and repeat culture if he becomes pyrexial.
Mr. Bettencourt, in view of the patient's history of heart valve replacement...
You're not exactly a houseman who dazzles me with his clinical acumen. As a result of your incompetence, the health authority is having to pay a gang of Irish navvies to rebuild a crematorium. Wind your neck back in and do as you're told. Already wasted enough of my time.
Dr. Raja, I believe.
Yeah?
I'm Mary Powell, the assistant hospital manager. I wonder if we could have a chat in Sister's office.
Sure.
A number of incidents have been brought to my attention, both from your time here and also previously on Ward C. These pranks of yours.
Mrs. Powell, these pranks were part of a fair exchange of practical jokes between the nurses and junior doctors.
There is such a thing as going too far. Following discussion with Mr. Bettencourt and Mr. Doherty, it has been proposed that we terminate your contract with the statutory 1 month's notice under Whitley Council regulations, owing to unprofessional conduct. Naturally, this will mean that you shan't qualify for full registration with the General Medical Council unless you repeat your pre-registration house job.
What? This is my career we're talking about.
Less tactful people might be tempted to comment, what career, Dr. Raja?
You have got to be kidding.
Yes, I am.
Sorry?
I'm no assistant hospital manager, but you, doctor, have been had.
Still 38.2. Right, what I'll need to do is start the
Dr. Raja, a moment, please. Monica's not answering her bleep. I've tried Mr. Bettencourt's secretary. He thinks he's already left for a meeting in the district.
We'll just have to start antibiotics anyway.
But I'd prefer if we waited till it's been discussed with either Monica or Mr. Bettencourt.
If Edwards has SBE, he needs antibiotics now.
I don't quite know how to put this, but...
What you mean is you have no confidence in my ability.
Look, you're a great bloke, so don't get me wrong. You're a good laugh and a great...
I'll draw them up myself.
Mrs. Lockley. Andrew, it's for you. Dr. Turner's secretary.
Hello? No! Is Dr. Turner there? Dr. Turner regrets that you will be expected to cover tonight.
British Rail regret to announce that the light at the end of the tunnel has been turned out.
Please take a seat.
Which one?
Now, how can I help?
Well, I know you don't usually see junior medical staff, but I really feel at my wit's end. I know Dr. Turner's already made an appeal on my behalf, but...
I think there's been some misunderstanding. Dr. Turner hasn't raised the matter with me at all. However, I am aware of the situation. I feel I should remind you that your contract does bind you to accept additional duties in an emergency.
I really don't see how this is an emergency when you've had 6 weeks' notice of Dr. Mardu's leave.
It is the nature of the National Health Service that we all have to take the strain at some time or other.
Well, in that case, Mr. Legg, perhaps you'd like to volunteer to come in tonight and take on some of the clerical duties that contribute to my workload.
Management and consultants are accustomed to the disaffection of junior doctors. You don't have to help us, of course. That is, if you can't bring yourself to show any concern for your patient's welfare.
Right, your peak flows are coming up nicely now, so you can go home tomorrow if you will. Change nebs to inhalers, stop IV steroids and continue prednisolone, 30 milligrams orally.
What was that about steroids again?
I'll do it.
Hi. We should talk, don't you agree? Maybe you could drop by tonight.
I don't know.
Please.
Tonight, okay.
Pretty sure she'd been drinking when she was on last night. She told me she never touched the stuff.
They make you work for days without sleep, then they've got the nerve to say that having a drink jeopardises patient care.
Anyway, about this Herbert with the query SBE.
Start broad-spectrum IV antibiotics, urgent echocardiogram.
No one will buy it.
Because it's you. You do the dog work, I'll bleep the cardiology reg.
Claire, do you think I'm a crap doctor?
Yes. Does that upset you?
Yeah. Whatever he's got, it's not endocarditis.
Thanks, Mark. It's a bit of bad luck, him not having a life-threatening disease. Wrong diagnosis, okay, but you made all the right moves.
Buy her a drink, take her to the pictures. No, you decided to woo her by doing an echocardiogram on her father. You're an idiot, boy!
Hello, Judith.
Hi.
Listen, I was wondering, maybe you and I could go out for a drink sometime.
You're just a bit too nice. I'm one of those mad people who always seem to fall for the bastards.
But I am a bastard.
I don't know. It always amuses me to see a doctor who would normally stop resuscitating a critically ill patient at the drop of a hat attempting to resuscitate a chat line long after it's dead.
The only reason I tried to help that fellow was to pull his daughter. Turns out he doesn't even have bloody SBE. I, on the other hand, have a raging case of FBE. Full bollock encephalopathy.
Oh, it's the same old story. A boy meets girl, father has echocardiogram, boy loses girl.
Their muscles all glistening with oil while they did their dancing.
Are you nearly done yet, Andrew? You've another one still to see.
Nearly. That chap's ready for the ward now, isn't he?
Have you called a porter for the bloods?
No. Sorry.
Cheer up. It may never happen.
I find it hard to be cheery when I've seen 12 shifts of nurses come and go.
When is someone going to see my mother?
I'm not the doctor looking after your mother.
I've seen you sitting on your ass, pen pushing. You doctors don't do bugger all.
If
I hadn't ended up like this, I'd have turned into something worse. Please.
A 17-year-old who's been accepted by the RMO. She took a paracetamol overdose about 10 hours ago. The GP was phoned and advised them to come straight up.
How many did you take?
Few? Dunno. We think she took about 20. She's been drinking.
Thanks. Why did you take them?
To teach my boyfriend a lesson. Only did it for a laugh.
You took about 20.
Just leave me alone, fish face. Let me sleep.
Nurse? Wash her out.
But her friend says she took the
Wash
tablets.
her out.
Why couldn't you have died in the ambulance?
Doctors are highly trained professionals. Yet we let our hospitals be run by spods with a 2-2 in geography from the University of Ulaanbaatar. I can't believe the management's so incompetent that they can't even find a locum.
They're not. We decided to not even look for a locum tonight. Much cheaper to persuade a houseman to cover. We force him to work tonight, but we shan't pay him because it's illegal to work the extra hours. An exquisite catch-22, don't you agree? See, junior doctors, they're like cattle. House them in crumbling flats, pay them a pittance, and they daren't bite the hand that writes their reference.
I want Andrew paid.
Oh, you're crazy.
Would you put me through to Mr. Betancourt's home number, please? Good evening, Mrs. Betancourt. And, Simon, stick to working on the anaesthetised. Your technique does nothing for the conscious body.
Why are you doing this? Now, you've had nothing but contempt for him before.
Because he bought me a sandwich. I've no speech. It's just wrong, that's all.
Sorry to get you up, Andrew.
That's okay.
35-year-old man, no history of heart trouble, but with central crushing chest pain tonight. ECG looks like an antireceptor. And there's one other thing.
I need to get a needle in your arm so I can do something about the pain.
Have I had a heart attack?
Oh, it looks like it. I've been working like this now for 3 days and 3 nights. So, how safe do you feel?
I'm so glad we got it together at last.
You're so Portland.
Andrew.
Dr. Turner.
A quick word. I've got a pile of letters to dictate before outpatients. Look, I want to remind you that it's highly irregular for junior doctors to complain to management. Any repetition is likely to lead to a suspension on the grounds of insubordination. So, I do hope we can now put this misunderstanding behind us.
Could you sign this form for the sputum sample, please?
Caroline, look, I'm sorry about the last couple of days. It's work and stuff, and maybe we can go out tomorrow night.
Look, I'm really busy this week. I'll phone you, okay?
Just popped in to do some bits before I go over to the General, doing the ACLS course today. Sure you'll manage without me?
Sure. Only 9 more hours to go.
How was last night?
I would have been grateful if a few of them had died in the ambulance.
A well-adjusted houseman would rather sell his own granny than have to get out of bed to admit her.
I just wonder what kind of monster I've become.
Listen, you work twice the hours of anyone else. Cope with testing circumstances when you're too tired to write your own name, and you still manage to help people. That's no monster.